Every minute of every day, a woman dies giving birth. A child in sub-Saharan Africa has a 1 in 10 chance of dying at birth. A trained midwife could easily save these lives, but many impoverished areas don't have enough qualified healthcare providers. In fact, the developing world carries 90% of the world's disease burden, but has only 10% of its resources. That dramatic difference cuts lives short and condemns communities to poverty. The situation is morally unacceptable. Physicians for Peace transforms lives by training, by supporting, and by empowering healthcare professionals who are working with the world's underserved populations. We lead with training, aimed at healthcare professionals because we believe education is the most effective solution to some of the world's most serious global health challenges. Physicians for Peace fills critical gaps in healthcare education and training. We expand the skill set of in-country healthcare providers so that they can serve their own communities. I think our work in Haiti provides one example. Haitians with disabilities have always faced incredible challenges. Even before the devastating earthquake of 2010, the country had very few trained healthcare professionals. The earthquake caused injuries leading to amputations for about 4,000 additional people. Immediately after the disaster, Physicians for Peace provided physical therapy at an amputee clinic. Today, we've actually served as many patients as every other provider in the country combined. But our therapists also trained the clinic's Haitian staff. That's a real achievement. The entire country has only 18 qualified physical therapists. But because of our education, because of our training, Haitians stepped into leadership roles as respected, qualified professionals. We gave them a hand up, not a hand out. We're efficient. Physicians for Peace teams are small and flexible. We work alongside host country providers in productive learning environments that don't overwhelm our partners or strain their resources. We seek out new partnerships with clinics, universities, government agencies, and other nonprofits that will reduce redundancies and help us reach more people. We're innovative. Physicians for Peace identifies leaders in people that society has ignored. In the Dominican Republic, for example, we train women from poor barrios to become mentors for pregnant teenagers. As a result, the young mothers and their babies are healthier, and the mentors are leaders in their neighborhoods. The changes are significant. When we empower women, we empower communities. We're accountable. People who invest in Physicians for Peace invest in human potential, and we take that gift seriously. 90% of all cash and material donations go directly to the field. We conduct regular program reviews to be sure our projects generate results, and we include the people we serve at every stage, from project planning to evaluation. Physicians for Peace mobilizes teams of committed healthcare providers who want to share knowledge and make a difference in the world. We are leaders in healthcare education with a reputation for delivering thoughtful approaches to patient-centered care. In practice, that means we teach our colleagues how to care for all of a patient's needs. For example, burn injuries occur every 5 seconds in the developing world. They're especially common among women and children. Burn injuries are lifetime injuries. When a patient arrives at a hospital, she needs someone to care for her painful wounds and prevent infection. But she also needs someone to help her move again and someone to heal her emotional scars. We make sure local providers have the tools they need to improve patient lives physically and emotionally. Around the world, Physicians for Peace responds with flexibility to our partners' needs, often working in health areas that would otherwise be ignored. We focus on immediate and long-term health challenges for a particular site and craft solutions that lead to lasting results. Regardless of the country, our goals are the same: self-sufficiency and better health. We want all people to have a fair chance at a healthy, productive life. We're always evaluating our work and looking for ways to deliver services more efficiently. That said, because we focus on training, measuring direct patient outcomes is a challenge. People benefit from our services long after we've returned home, and capturing information on all of the lives that we've touched is difficult. Take Nigeria, where we train midwives. During a mission, we can assess the midwives' skill levels, present workshops, and plan for future needs. But we won't necessarily be with a midwife when she's called to a mother's side. She'll have to make critical decisions on her own based on her training. We make sure she's ready for those situations and prepared to teach others. We want people to feel empowered and supported, and we want those feelings to multiply from one healthcare provider to the next as our training is shared among colleagues. When that happens, we know our programs are working and that we're making a difference. When Dr. Charles Horton founded Physicians for Peace in 1989, he envisioned the organization as a corps of medical diplomats, healthcare providers from different backgrounds coming together to teach and learn. Because of our name, people sometimes misunderstand our mission. Physicians for Peace focuses on healthcare education and training in underserved regions. We have no religious or political affiliations. We're not an advocacy organization. We're not first responders. We work across borders of all kinds to build capacity and improve health. Since 1989, we've delivered education, training, and millions of dollars in medical supplies and equipment to partners in more than 60 countries. Some recent accomplishments include, in the Philippines, a nation with 6.8 million people with disabilities, we launched the country's first 4-year degree program in prosthetics and orthotics. Through a postgraduate medical education program, we tripled the number of pediatricians in war-torn Eritrea. And we founded the Central American and Caribbean Burn Consortium that brings together healthcare providers from across Latin America for unprecedented continuing education. On a personal level, when I think of success, I think of Charisma, a young woman in the Philippines who underwent a high-level pelvic amputation. Since she couldn't stand for long periods, Charisma had to abandon her dreams of becoming a nurse. But thanks to Physicians for Peace, when Charisma needed care, a trained team of Filipino healthcare providers was ready. She received a prosthetic leg, physical therapy, and a second chance at a fulfilling career. Today, she's a medical transcriptionist. We changed Charisma's life. Now Charisma can change someone else's life. Our work isn't about charity, it's about empowerment. That's the beauty of the Physicians for Peace model. Unfortunately, we've ended projects prematurely in Eritrea and Libya because of internal political pressures and unrest. The hospital where we work in Libya has since been destroyed, a profound loss for that country. If there's an opportunity to return, we'll go back. Now more than ever, those countries need trained healthcare providers. Fundraising is a challenge. We always need people to step forward as global citizens and invest in our programs so that we can plan for comprehensive projects that address our partners' long-term needs. To make a real difference, we must work together to lift up communities. Education can do that, but we need everyone's help. With additional resources, Physicians for Peace could scale up our most successful medical training programs. We could create more opportunities, heal more people, and save more lives. Many of the solutions we've formulated can be replicated. We know our model works. We also know that techniques we bring to a burn clinic in Ecuador are as important to hospitals in the West Bank, that nurses in Malawi have some of the same needs as nurses in India. We already connect people with the training and resources they need to build healthy communities. With deeper pockets, we could do that on a much larger scale. Factors beyond an individual's control can devastate health. We know that traumatic burn injuries are far more common in overcrowded neighborhoods, and that young, uneducated mothers are less likely to use interactive play to develop their children's motor skills. If we prevent disabilities and injuries from happening, we break cycles of poverty that hurt us all. There's also a widening gap between the technology available to healthcare providers. We see that gap firsthand. It's the difference between a state-of-the-art operating room and an understaffed clinic. Because of our partnerships around the world, we can identify the most useful tech innovations and share them. As technology advances, everyone, regardless of where they are born, should benefit.